It is not always easy to witness somebody getting diagnosed right in the moment. And if I see there's any deficit about not understanding even what lung cancer means or a fear of chemotherapy, I try to chime in exactly where I feel we need to start. And this is how the trust relationship starts usually with me and my patients.
The nurse navigation services, it is complementary to all of our oncology patients. I'm educating the patient, I'm giving them the logistics of where to go. So it's that personalized care that patients need when they're going through a difficult time of a cancer diagnosis.
The connection I have with these patients is lifelong. In my experience as a cancer survivor as well, I think sometimes that gives me a little edge, being able to say, I've been there, I've survived it. This is what we're gonna do to get you through this.